Jamin Stewart and his friends drove to Florida for spring break, but say they're still keeping the pandemic on their minds.
I get how people can get confused or forget about COVID when you're here, but we just try to remember it and stay safe.
A little bit during the beginning of spring break here, it got a little crazy.
Now the CDC says in states including Florida and California, a quarter of cases are a more contagious variant of the virus, and they expect it to spread.
Our current models still project, but by the end of March, early April, B.1.1.7 will be the dominant variant.
B.1.1.7, the variant first discovered in the UK, is 55% more deadly and spreads faster and more easily.
It's not evenly distributed across the United States. We do have B.1.1.7 reported in 50 jurisdictions, over 4,700 cases reported so far, and that's just based on what we're evaluating and sequencing.
Until we get people vaccinated, we're really in a race between vaccines and variants.
Variants aren't going away. The numbers we're seeing could be much higher, and that has everything to do with something very sciencey and technical, but key to finding and fighting variants: genome sequencing.
You can't get it done at home, you can't get it done at CVS, you can't get it done at your local healthcare provider. It's more the researchers at these larger research institutions can isolate virus from an individual.
So here's the gist with genomic sequencing and variants. There are about 30,000 genetic isolates, or pieces, represented by the grains of white sugar here, that scientists have to go through in one swab of sample in someone's COVID test. And scientists have to go through every single little piece to make sure that there isn't any type of mutation or variant. So those mutations are represented by this very generous teaspoon of brown sugar here. The way that it works, mutations happen all the time and might be a change in about a dozen or so isolates in one sample. But scientists still have to go through and analyze all of those 30,000 little pieces to make sure they've correctly identified or sequenced the variants. And that is very slow and very expensive. The CDC says it takes about 10 days to sequence one sample, meaning when the results come out, a person is past the most infectious stages of disease, limiting public health officials' ability to contain it. The cost of one analysis? From $25 to $400. Ramping up sequencing is happening at both state and local levels, but right now, every state is far below sequencing around 5% of cases, which experts recommend. Only 6 states are sequencing even above 1.7% of cases: Hawaii, Utah, Wyoming, Oregon, Washington, and Maine. Bottom line, even with vaccines, variants will keep cropping up, so it is important to keep following public health guidelines.
We're close, and I think that's what people feel too, but we all got to do our part so we can get to the end.
Lindsay Thies, Newsy, San Francisco.